Now, one of the things that's going to be very important as a massage therapist is to take care of yourself. There's no better tool out there than the Hypervolt as far as your self-care program. So to use the Hypervolt in your self-care program, one of the things that we're going to do is address the upper body when it comes to your self-care program. So we're going to start with the palm. So with your palm up, you're going to take the Hypervolt, turn it on, and you're going to find a setting that's going to be right for you, something that's going to be comfortable and not aggravating. We're going to go and take that Hypervolt and we can lay it flat. So as one variation, we take the applicator and we lay it flat and we can run from the palm to the fingers. So we can trace from base of palm to the pinky, base of palm to the ring finger, all the way to the thumb. Now, as a variation, we can use the edge of the applicator by turning the Hypervolt on its side. So here we can still run the same direction up and down from palm to finger, pacing back and forth on the palm. Now, as we finish up the hand, what we can do is just move our way up to the forearm. Now, as massage therapists, one of the areas that does get pretty tight and tired is the forearm. So one of the ways we can get fluid and get blood flow back into the forearm area is to go ahead and go from elbow to wrist. And we can go from medial to lateral and lateral to medial when it comes to the forearm. So one technique that we can use to improve flow and relax the muscle in those areas is to now go ahead and hold the volt in one spot, and we can go through wrist motions. So this wrist motion, we can go from extension to neutral and then into flexion. So going all the way from an extended wrist to a flexed wrist position. But we can also go into the turning or rotary motions and start to supinate and pronate at the wrist. Now we can do this both on the medial side as well as the lateral side of the forearm. Now as we move up the arm, now we can address the biceps. So here we're going to go from the crease of the elbow up to the front of the shoulder. So again, moving at a pace of about 1 inch per second, we're going to come up and down, going along the direction of the muscle fiber, and we're looking for those areas that might offer a little bit of tension. So once we've found an area of tension, we can hold the Hypervolt in place and we can go through elbow flexion and extension. Flexion and extension. And you want to perform this 4 to 5 times, or however much it takes for you to feel relief in the biceps. Now, right above the biceps, we have the shoulder. So from our angle, with the volt coming from the opposite arm, we can go up and down the front of the shoulder. You can reach towards the lateral part as far as your shoulder will allow. Now again, the one thing we want to monitor is that acromion process. Just as it is for our clients, as it is for ourselves, we don't want to go over any bony notches that might cause some aggravation or feel uncomfortable. So as we finish up the upper body, we can now move our way down to the lower body. So as a therapist, you have a table available to you, and what you can do is sit on the table. So with your leg outstretched, what we can do is work on the anterior thigh. First, we're going to come from the knee and work our way up to the hip. From kneecap towards the hip, we can sweep the Hypervolt more from the adductor complex over the front thigh and then to the outer thigh. So one area that tends to get overactive and tight is the TFL. It's one of our hip flexors. So how we address that is we're going to extend one of the legs. We're going to go ahead and lay back, and this way your hip isn't as flexed and gives you more exposure to the TFL. And the TFL is right below that bony notch, or what we call the ASIS, or anterior superior iliac spine. Now this muscle runs down and away on the hip. It's a very short muscle, but it's one that does get aggravated and a little tight at times. So we can go ahead and sit up, and with our leg extended, we're going to go ahead and use the Hypervolt on the inside of that left calf. So with that leg flexed, we can flex at our knee, and we can run from the knee down to the inside ankle. So nice and easy, inch per second. Now we just want to make sure that we're not running the Hypervolt on the shin bone, so we do want to stay on the medial part of the lower leg. Again, sweeping from the shin bone down to the inner part of the calf. Now as we work down from the lower leg, we can go ahead and cross our left foot onto our right knee, and now we can go ahead and address the bottom of the foot. So from here, we want to run from the heel up to the ball of the foot. Now, depending on where you might feel some sensitivity or tension, you can go ahead and hold the volt in a different spot as you go from toe to heel. Now, just like with the hand where we use the edge of the flat applicator, we can go ahead and use the edge of the applicator on the bottom of the foot as well. Now, to get those areas that might be a little bit more sensitive than others, we can hold the Hypervolt in place and just flex and extend our toes. And this does a lot to relieve the tension that typically happens to the plantar fascia. Another selection for applicators here are the bullet or the fork. Depending on your preference and depending on the amount of intensity or pressure you tend to feel, you can switch applicators at any point in time. Now, to address the outer part of the thigh, what we'll have the massage therapist do is get into a hurdler stretch position. So in this position, we have access to more of the outer thigh, where we can work from the pocket or the TFL down to the knee. Depending on your ability to get into this hurdler stretch position, you can prop your knee up, or you can scoot over to the other edge of the table and open up and get a little bit more angle at the knee. So here we go from hip to knee, and as we move down to the lower leg, we can get the outer portion of the calf and work from knee to ankle. And this is the self-care protocol using the Hypervolt.